All right. Well, thank you all for coming today. It's 10:30. We'll give everybody another minute or so to get logged on. I see new people popping in. And if you would please put your information in the chat, your name, organization, and email address will be sufficient. We would appreciate that. And we'll get started in about a minute. Great. Okay.
This is
well,
Anne in Sanger. I'm on the phone only.
Okay, sorry, repeat your name.
This is Anne in Sanger.
Oh, hey, Anne. Good morning.
Hey, hello. I'm just on the phone. That's why you may not see me pop up on Zoom,
Yes.
on the computer.
Okie dokie. I've got one other person on the phone. Hello. Let me. And so if you're 713-4074.
No, I'm 9.
No, Anne, I've got you. I know your phone number. Sorry, go ahead.
Yeah, this is Tarnisha. I'm the 4074 number.
Okay, great, Tanisha. Thank you. All right. Well, it is 10:32, and we do want to be respectful of everyone's time and make sure we have plenty of time to answer all your questions. So we will get started. I am Julie Wright. I'm the program manager for Denton and Wise counties, for the region that encompasses Denton and Wise County. And I'm going to let our team introduce themselves. Cipriano, we'll start with you.
Hello, everyone. I am Cipriano. I'm the Chi intern with Julie. I'll be working with her till next May out in Denton and Wise counties.
Melanie.
Hi, good morning, everyone. I'm Melanie Neswadomi, and I'm a community health worker in our community health improvement department, and I cover Tarrant and Parker and helping in the WISE team as well. So good to have all of you.
Melanie's actually a social worker, but she's been meeting with her community health workers this morning.
Goodness.
I didn't know if you even noticed you said that. And so then now I'm going to turn it over to our director and let her introduce herself and get us started. Danelle, you're muted.
You know that meme that says the most said sentence in 2022 is you're on mute. So I'm Danelle Parker. I'm the director of community health improvement for the Collin area and also the Denton and Wise area. And I am going to be starting our webinar today. So give me just a second to pull it up and share. Actually, I did it in the wrong order. Okay. Here we go. Can you see my screen, Julie? Okay. So, thank you for being here today. And we're just going to talk a little bit, just real casual about the Denton Wise request for proposal and answer any questions that you guys might have. This will be new information for some, and it will be old information for others, but just know that we're based nonprofit health system, and our mission is to improve the health of the communities we serve. We work closely with community leaders like yourselves, stakeholders. We identify health disparities and socioeconomic conditions, and we work to address them. And we work to address them through partnerships that we have with our communities. If you're a nonprofit working in the community, even if you're not a nonprofit working in the community, you should know that, there are differences between different communities, not just when you're talking about an entire county. You're talking about zip code levels and even sometimes pockets of people that exist, and not everybody needs the same thing, right? And so we've said along our journey with community impact is that your zip code shouldn't make a bigger impact on your health than your genetic code. And so we're working to address those inequalities that really affect the health in the communities. And, this year we've, the past 2 grant cycles, the past 4 years, we've had about $5 million to grant out across the 5 regions. Which, it's a lot of money, but when you divide it, out to 5 and look at socioeconomic needs index. So this year we're super excited to say that we have $8 million. Texas Health footed the 5 million, and then there were partnerships like Communities Foundation of Texas that said, hey, we really like what you're doing, and we would like to jump in with you. And so they added another 1.5 million. And then, surprising everyone, our CEO, Barkley Burdan, announced at one of the board meetings that, hey, he was going to throw in another 1.5 million. So we have a total of $8 million this year to grant out. And Denton County has actually received 1.3 million of that 8 million to work in the community. So I'm going to talk a little bit about our program goal. We want to make sure that we don't abandon the work that we've done in the communities that have been focused on the last 4 years, last 2 grant cycles. And so that's Sanger, Louisville, and Bridgeport. But we did want to make sure that we were capturing some of the greatest needs in the areas that we were serving. And so this year we were able in Wise County to add Chico to Wise County. And so we're very excited about that. We want to continue to advance the mission that, we improve the health. We want to focus on these 4 zip codes. We realize that, some of these zip codes have a stronger foundation than some of the others, like Bridgeport and Chico. And so the programs will look different and the needs are different. And so we do recognize that that is the case. We wanted to really address obtaining healthcare services such as prevention, diagnosis, treatment, management of disease, illness, disorders, and other health impacting conditions. And for healthcare, when you talk about healthcare access, it must be accessible and affordable and convenient. And so there's a little graph here that talks about the 5 A's, and we'll go over those more in depth. But it's not just any one thing, right? It's like, oh, well, let's build a clinic. No, if people can't get to the clinic, it's still not accessible. And so we have actually given you some definitions of those 5 A's, and just, affordability obviously is one of the A's, and just really looking at, the ability of the community that you're serving's ability to pay, and taking that into consideration. Availability, if you have these paycheck to paycheck, no time off, job workers that need also to have, doctor visits, they can't come during the day. They lose money if they come during the day. So how do you meet those needs of the individuals that don't meet the normal 8 to 5 hours? Accessibility, again, we can probably point out locations in both of these counties that really don't have the accessibility to, or accommodation to a clinic. Where is it? And, if you have to jump on, if you're in Louisville and you need to go to a doctor's appointment in Denton, that's a good, 45 minutes each way, if not longer, plus the doctor's visit. So just keeping those things in mind. And then really want to focus on is the acceptability. You know, we are becoming a melting pot. North Texas is, and we really are just, being blessed with a lot of different nationalities and different cultures, and recognizing that they have different perceptions of healthcare. And I think if you've been in the healthcare or even nonprofit world this past, 2 years, you recognize that they have preconceived ideas of healthcare. They have preconceived ideas of what health is. And they have, rational or irrational fear of going to the doctor, such, a case that we saw when I was working at Texas Health Plano is that a woman from Thailand was so afraid of going to the doctor that her breast cancer grew so much that it became an abscess on the outside of her breast before she would actually go to the doctor. And of course, at that point, it had metastasized and there was nothing they could, do about it. And so just taking into consideration the different cultures that we're serving. Okay. We are stuck. Hold on. I got to get my cursor on the right screen. There we go. Yay. So we've split up Denton County and really looked at two different program objectives, Denton and Wise County. We didn't split up Denton County, sorry. And really this strategic plan focuses on increasing access to healthcare and improving navigation services. It sets forth the following mission, the goals and the targets. And so really in Denton County, we believe that especially in Denton, the city proper, there are a lot of resources, but they're all right there. They're all in the northern region. And so how do you get navigation services to actually help improve the access to the services that are in the targeted zip codes, which are not in the city of Denton proper? So Denton County goals is equitable access to healthcare and community services. So we have the healthcare piece, and then we also have the social determinants of health piece, because realizing if you really have a problem with food insecurity, getting access to your medications or even getting to the doctor or paying for gas to do an extra is just, it's not going to work. So really want to make sure that we're able to give people what they need in addition to keeping them healthy or managing their chronic disease. And so that covered goal 2 as well. So navigation to services in Denton County. And what does that look like? And it looks like different things in different communities. And so the target population that we chose based on our community health needs assessment, which we are finishing up this year, and it will be published for people to reference in January of 2023, is older adults 55 plus. Realizing that, most of the adults that are struggling with chronic disease may have caretakers or family members. So we don't want to exclude their caretakers or family members. We want to be able to address those older adult populations, but we also want to look at how do we care for their families as well. And then again, we want to target families with limited resources. And so this, all of our programs address the disparities in our communities. And that, looks like a lot of things, right? Disparities in health, disparities in access, and disparities in poverty, right? There's that generational poverty that just goes around and around. And not that we can boil the ocean, but just really want to look at those disparity populations and limited resources. Okay, so I'm moving on to Wise County, and I want to stop for a second before I change and switch gears. Does anybody have any questions about the program objectives for the Denton County zip codes?
I have one question.
Sure.
So for a proposal, would we need to target both Denton County zip codes and both target populations and both goals? Or would we be able to focus on one of each of those? Or what is that requirement?
Yeah, no. All the zip codes and all the different disparities or goals and populations. Again, we're looking at and we want innovative partnerships that address at least one of all of those, meaning zip code, the goals and the target population. The target population is kind of tricky because we're not going to serve people that already are being served, right? So the families with limited resources kind of is wrapped up in the first one, which was 55 plus and the family and caregivers. Does that answer your question?
Yes, thank you.
Sure. Does anybody else have a question before we move to Wise County? Yes.
Hello,
Yes.
Danelle. It's Anne. I have one question.
Sure.
And you may have answered it already, and I'm just I have brain fog today. So the older adults 55 plus, that is a required component of your target population. Is that correct?
That is a required population. Yes.
Okay. Thank you.
Sure. But it's also their families.
Right.
Right. Okay. So we're moving on to Wise County, and the program objectives for Wise County are a little different, realizing it is a much more rural county, and the zip codes are very rural, and they have very limited resources, if any at all. And but they have a great need, and knowing and what we have done, we took our community health needs assessment, but we also went back and did our own legwork in Wise County and did some key informant interviews with the sheriff's office and the mayor of Chico, and we were able to really look at, if you could have a program that addresses a need in Wise County, what would that be? And they were able to give us some insight into the isolation that occurs in rural counties or rural zip codes like Chico and even Bridgeport. Bridgeport has a little bit more than what Chico does. So we decided that the strategy continues. We have in the past focused on behavioral health, and we have worked with the Children's Advocacy Center to actually bring a resiliency building program and work with the communities to help increase food access in Bridgeport. And we wanted to continue focusing on behavioral health, but we wanted to include substance use disorder and treatment and reducing the household food insecurity. So well, that was not fun. Are we good now? Okay, let's try that again. So we wanted to increase food security and but it's access, but adding access to healthcare or just care and in general. And what we have found in Bridgeport is, we have laid a foundation, and we're continuing to work on that foundation for food security through our resiliency program and providing grow towers in the ag class at Bridgeport High School so that the students can learn to grow their own food by a means that doesn't require necessarily building beds or a big garden. And we also were awarded, THR was awarded a USDA grant that we wrote for the city of Bridgeport that was going to also provide a 3-year it's a 3-year grant where we were going to work with the city and others to build a community garden within the Park Services area. And so we're working on the food security in Bridgeport, but we want to make sure that we're including Chico in that process. So the goal 1, we want to enhance the access to healthcare and community services, which is up to including just about anything you can think of. But we do want to focus on equitable access to behavioral health care and substance use disorder. We know that there is a large substance use disorder, the substance abuse need in Chico and Wise, and they have, in order to get help and to receive the support that they need, they have to drive to Decatur, but you're more likely to go and receive treatment if it's in your own community. And then we also want to address the fact that, again, if you can't eat, if you don't have the food in that area, if it's not easily accessible or there's not healthy foods available, you're really not treating what your whole body needs, right? And this is a very holistic grant. And so again, our target populations are, we want to recognize that there's many times a reason behind substance abuse disorder. And we also recognize that in families where there is substance abuse disorder, there is also abuse and neglect. And so we felt like we really wanted to have that target population and really say, victims and survivors, users, and those that live with their addict. You've all probably gone through something. And so we can really work on that target population in a very broad aspect there in both Bridgeport and Chico. And then again, we're going to focus on families that have limited resources. So again, that compromises a very large portion of both of those zip codes in Wise County. So pause for a minute. Questions about Wise County program objectives and goals?
Hi, this is Tracy. I want to make sure you can hear me. I have a broadcasting studio and I don't know if my microphone is picking up or not. Can you hear me?
Yes.
Okay. A question that I have, just because we do have locations kind of all over with our partners, because they're located all over, are these different services, whether they're mental health services or things that treat the things that you do, are those available or where we can provide them online as well, just so that we can maybe even meet people where they are? Because sometimes with this population, transportation, is an issue. And so we try to offer programs that, hey, we'll bring it to you per se. So will that be something that you would be interested as well?
Yes.
Okay, thank you so much. I appreciate it.
Sure. Any other questions? Okay, I'm going to move to the next slide. Okay, and it's present again. So the next slide, we talk about the expectations of the RFP, and again, there are some criteria of how to apply and some rules around, what this needs to look like. Obviously, this first word here under expectations is collaboratives. And so we want to see one or more organizations work together on these RFPs and the proposals they're submitting. It doesn't have to be a large collaboration. It can be, we've had, I think, 6 organizations in Collin County work together, and they worked really well together. We've had 5, we've had, 2. And you must work in one or more zip codes. there must be a lead organization, and that organization has some roles and responsibilities. And, again, we'll talk more about that, I think in a little while, but, again, the focus on the innovative solutions to health equity issues. So you mentioned, telehealth, that, it is and was a innovative way to do a lot of things during the pandemic, right? This grant is expected, and the programs are expected to run for a 2-year period beginning January 2023, or when the MOU is executed. Programs, will be assessed quarterly through reporting from an independent evaluator. So you don't have to worry about the evaluation piece. Providing it, we'll provide that for you, but you do have to provide the data to the evaluator so that we can get those quarterly reporting. Continuation of a program funding will depend on, the progress of this grantee. So, for instance, there has been a situation where one of the community sub-grantees didn't open on time. In fact, they didn't open for an entire year, and they were still listed on the grant and still wanted their money to help with them get supplies. And we gave them some at first, but then we kept hearing, okay, we're going to open in 3 weeks. We're going to open in 2 weeks, and a year later. And so we had to make the decision that you're not going to get funds until you open. And so, just again, the progress and availability, realizing that, you must be working on the grant even through hardships and difficulties. And that's what that grantee should have been doing. The lead organization, that's the responsible party. You're responsible for bringing together all the organizations that, are listed in the grant, the sub-grantees that actually, meet monthly and say, how's it going? What do we need? Do we need to move things around? Are we running, are we on track, to meet our goals? And, and keeping track of that goal and where you are is really important, because if you don't know where you are and where, and where you need to be is at 500 and you're at 250 and you're more than, halfway through the grant, you really want to look at things like that and stay on top of them so you can make adjustments as you go. And that is part of the lead agency's responsibility, and holding organizations in their proposal accountable for what they said they would do. And then again, being able to manage the size grants that Texas Health is looking to give out. Again, we have $1.3 million for Denton and Wise. And, an organization that, doesn't necessarily have that experience, is maybe, if there's another choice, that may be, a good way to kind of get experience. But we're not saying that if you haven't had experience and you're capable of doing it, that you wouldn't be allowed to be a lead organization. So funding eligibility, oh my gosh, y'all excuse me for a second. Need to take a drink. Okay, so again, we have $1.3 million available. The lead applicants, the grantees, the proposal can apply for the full amount. But again, you have to justify why you're applying for that full amount. And you more than likely will need to address, more than one area, right? You may have to really address all 4 areas if you want the $1.3 million. The non-exclusive list of potential league organizations, again, you can see that there. It's very inclusive. And again, if you have a question about whether or not, an organization is eligible to participate in, in a grant, please reach out to Julie, and just really, we can walk through, who is able to and who isn't able to. So the exclusions for the grant, again, indirect costs cannot be more than 15%. It can't go to endowments or capital campaigns. Again, you can look there. This is pretty common. I mean, I guess you see this in other grants, that that are out there, and again, lobbying activities, those type of things, and you can read this here. But one of the questions that came up was direct delivery of reimbursable healthcare services. So for instance, if you want to use the money to cover the care of a Medicaid patient, and you want to use the money, you're going to also charge for the Medicare person. That's double dipping, and you can't use the grant for direct delivery of reimbursable healthcare services. And I know that, that's obviously it's like, we know that already, but we have to sometimes say it out loud. So, and so again, it's a pretty inclusive list. If you go back to the other slide, and the exclusions are the ones that are pretty common, but if you have any questions about this, you can definitely ask us. And now I'm going to turn it over to Julie for the fun part. Julie, do you want me to run the slide, or do you want to do it?
Yes, I'm gonna need you to run the slide. My power just went again, and I'm on my phone.
Oh,
Yay, CoSurf.
sorry.
Okay, well, thank you. That's okay. I'm back up, but it'll be a few minutes before my router is on, so, oh well. We planned for this. So just to take you through a few of the things that are going to be required of you when reporting. Oh, that's nice. Yeah. No, that's really loud. Okay.
Julie?
We're gonna start.
Julie, are you on your phone, or are you on the computer?
I'm on my phone. I don't have internet back yet.
Okay, so we're seeing the top of your head.
Oh
no, you're good.
Okay.
You're good. It's just upside down. There you go.
Okay.
Okay. So can you guys still see my PowerPoint? Thank you. Julie, you're frozen. It happened yesterday too.
Okay, guys, I'm back. I guess my router is back up. My phone was trying to connect to Wi-Fi. All right, so some of the forms you're going to need to have for the application are the project plan table and the budget and financial information, and those are all encompassed in the same Excel file. Danelle, if you will advance the slide, thank you. The first is that project plan table, and let me get in here where I can actually see it. You can see it's got the heading at the top, the organization name, and all of that stuff. And then we want to see your list of planned activities. What are your main activities, actions defined in your project? And it gives you an example there. What is the objective or goal? And we do highly encourage you to use the SMART format: specific, measurable, attainable, SMAR. Sorry, I haven't had enough caffeine this morning. Realistic and time bound. So we all know that, I'm sure, but just a reminder. And then what is your measure of success going to be? So what outcome are you looking for? We do want to know your outputs. We want to know your reach, how many people you served, and things like that. But really the outcome, that improved health metric or increased resiliency is what we've been measuring in Denton and Wise. We want to know those outcomes especially. And then give us the timeline. When do you expect to start, and when do you think you will be finished with that item? And so that is the work plan. Danelle, if you'll advance, please. And so then the budget and financials are here. And you will put in salaries if you have any consultants or you contract out any labor, any anticipated meeting costs, supplies, so on and so forth, travel expenses for training purposes or mileage, especially if you're going to be driving out to Wise or up to Sanger from anywhere. It's We understand there's some geography involved. And then your indirect costs will go there. We do ask that you have a separate tab for each of your sub awardees. So all of your partner agencies, if you can put them in the consultant and contract labor, one line for each sub awardee, and then a separate tab for them. That makes keeping track of everything a whole lot easier for all of us. And then we will go through and adjust it. And then throughout the life of the grant, the others, when you do the application, these cells will be hidden, but they are there in that document. And so you can see how we track spending. And so this is the report you will turn in every quarter, just to keep track of your finances. And so like I said, each of your sub awardees will have a separate tab, and then they will have a line on the main item. And it makes things so much easier to track. That being said, I'm sure those verbal instructions were somewhat confusing. There is an instruction tab in the file that will help you walk through that. And if you get stuck anywhere, by all means, reach out to me and I'll walk through it with you. Next slide, please.
So we just wanted to make sure that you were aware of the timeline. Oh, am I on mute?
No, I can hear you.
Okay, good. Well, that's good now. So again, we released the RFP July 15th, and we are asking for all of the proposals to be back September 16th. We've got a really tight turnaround for us, and we have to, review the grants. We have to get them to our leadership council. The way this works is that we don't actually decide which grants are going to be funded. That is up to each region's leadership council. So they need time to review the grants. And once they review the grants between the 16th and whenever their next leadership council meeting is, which I believe ours is October, you said 16th, but isn't it October 10th? 16th, Julie?
Ours is
October 12th. Okay.
12th.
The 12th. So, we have to make a decision on who the leadership council would like to come and do an in-person presentation. And so we'd ask for you guys to go ahead and mark October 12th on your calendar. It'll be somewhere between 11 and 1. And it will be somewhere in Denton, most likely at the Denton THR hospital there, but you will get that information once you have been selected to actually present your proposals. Once you present your proposals on October 12th, we have to get them, the ones that are selected have to go to the Community Impact Board, which oversees all the leadership councils. And so they meet in the third week, I believe, in November, and they will approve the ones that are selected or ask more questions. And then you will be notified in December. And I would love to say you're going to be notified by the middle of December before Christmas, but we'll see how that works. So stay flexible. Do you guys have any questions about the timeline?
Not about the timeline, but I do have another question.
Okay. Do you want to let us finish a couple slides and then we could ask it?
Sure.
Okay. Julie, I believe the next one is yours.
And I'm back on my regular computer now. Yay.
Yay.
Sorry, that threw me for a little bit of a loop, even though I was expecting it. And I've got the jets flying over. I live next to Alliance Airport, so if there's any background noise, I apologize for our fighter pilots. They're just doing their job. So proposal requirements, again, Danelle outlined this earlier, but we do have our 4 target zip codes. And we do want you to focus on one or more of those. That is Bridgeport, Chico, East Louisville, and Sanger. You must address at least one healthcare access need and one social determinant of health. That could be food insecurity, transportation, or access to culturally competent services, and should incorporate free or severely reduced healthcare services. Remember, our target populations are in the low income, uninsured or underinsured, Medicaid, and our ALICE households. ALICE are, if you're not familiar with that acronym, is asset limited income, oh, now I've forgotten. Anyway, it's our working poor, basically. Folks that are upper, lower class or lower middle class, that they're making money, but it's barely enough or not quite enough to cover their usual living expenses. Oh, I'm not doing the slideshow. Next slide, please. I was trying to scroll with my mouse. Frequently asked questions. We do have a sheet of questions posted on the website already from our previous request for proposal. We will continue to update that weekly. In fact, I've got an email set to go out to the web team this afternoon with some updates from our previous Q&A sessions with the other regions. And so every week we'll update any questions that come through, either the Q&A sessions or the email address. So those are going out on the website, and we will be responding to those through August 19th. So you have plenty of time to get us questions. If we don't answer them here today, I will go through the chat here this afternoon and pull those questions if we don't address them today, and make sure that you do get a response. And then there is the link as well for that. Remember that submission deadline is Friday, the 16th of September at 4 p.m. Central Daylight Time. And if you've got questions, that email address is thci-grant. I'm sorry, that should be grants with an S, at texashealth.org. And the FAQ page is at that link. We will make sure these links are available to you in the chat as well. And
That's
I
all
think
that's
that is
all
it.
we have. I'm gonna stop sharing or stop presenting. And if you guys, we would love to take any questions that you have. Let's see if I can get.
Danelle, before we open the floor, there is a request for you to repeat the information about reimbursement and double dipping for Medicaid and Medicare.
Okay, so let me see if I can try to explain that better. So if you are in your grant, you are seeing clients that you are being able to be reimbursed for that care, whether it's Medicaid, Medicare, or private insurance. You cannot charge those patients and provide care through the grant. Did that come out more clear? Did that answer your question?
Even if it's separate services?
Yeah. So give me an example.
So I guess an example I have would be like, we're providing a psychiatric eval for a youth who's on Medicaid. We bill for that, but then we also, through this grant, provide them a service that's not billable to Medicaid, like counseling or some sort of case management service.
So my initial is no, because the people we're targeting do not have that resource. We're talking about people that don't have Medicaid, Medicare, or any billable resource. Does that make sense?
Totally.
So I have a question then. I'm sorry, this is Sherry with PD Place. And so my question is, of course, we see over 14% of our patients are uninsured. So we can write this grant with, let's say we're doing a school-based clinic, we could write this grant for the uninsured because we're not receiving reimbursement for them, correct?
Correct.
Okay, thank you.
Did that answer your previous question? I didn't see who was asking it.
It did. It was me. It was Sherry who asked, and I really appreciate it.
No, the guy that was asking before you.
Colin.
Colin.
Okay, I'm
Yes,
sorry.
you did. Yes, thank you.
Okay, all right.
Danelle, there was one other question. I think you may have already answered it with Kate. And it said, so did Nell just say that 1.3 million can go to one lead agency if their collaborative will work in only one county?
No, I didn't say that. Exactly. I said you can ask for it, but that it would probably not be given to just one county, one zip code, one lead agency collaborative, that you would more likely need to address more than just one. But I did say, Kate, you could ask for it.
Hi, it's Tracy again. I love that, what you just said. I've got a quick question. I was looking at your proposal requirements and I understand everything. And I'm really excited about this, whoever gets the grant, because this is such an area of focus that is so needed. And I just want to thank you guys for all of this. Whoever gets it can serve people who need it. The question that I have is when you get to the things that you need to address, of course, we know healthcare, 100% the food insecurity that has to be there, transportation, and the next one is access to culturally competent services. Can you expound on that for me, if that's okay?
Sure. So culturally competent, like I said earlier, we're being blessed with the influx of different cultures, refugees, just people coming for different reasons. And if you put, let's say, for instance, the Thrive program, if you put a grocery store in the middle of a Muslim community, a grocery store that's in the school of a Muslim community, and put the same foods in it that you would put in a school that has, 65, 70%, white American kids, the food you would put in that grocery store would need to be culturally competent. And so, other words, really diving into looking at, what are their staples? And that's very, we have learned that over time through the Hispanic community. You can put fresh fruits and vegetables, in a pantry, but if people don't know how to cook them, they're not going to eat them, and they're going to always go back to what their main staple was. And so another example, that's, for instance, is, access to healthcare. Okay, so let's say that there is a clinic in the middle of a Asian community, and this is a true story. And that clinic wants to serve that population, but they really don't dive into how to get that population to the clinic, right? It's very relational. It's education. It's being able to build that trust, because they don't really trust hospitals for a variety of reasons. So how do you culturally competently provide that education to get them into your services?
So it's kind of like topics that pertain to them or things specifically to how they live, what they're about, or even speaking the language, having the ability to speak the language bilingual or their language in particular. Am I saying that right? Just want to have a clear understanding.
Absolutely. I mean,
Okay.
it's as easy as, speaking to them in their own language, and as complicated as knowing, their beliefs.
Okay. Thank you so much again.
Sure. More questions? These are great questions. It actually makes me really excited to see what the proposals are going to be. This is the fun part of my job. I have lots of fun parts of my job. I can't lie. I mean, I really do, right? Melanie and Julie, Cipriano, you're getting a taste. But it's always fun to talk about ideas of how we can serve the underserved in our community.
I have a really quick question. My name's Colin, by the way. I work at Denton County MHMR.
Hi, Colin.
So I totally understand in terms of like socioeconomic and population growth, data in Sanger and Louisville particularly, and how Texas Health came to that conclusion that those two zip codes need access to things and services and resources. But is there another sort of maybe implicit like data point or something showing that individuals or residents living in those two zip codes are like actively not receiving services, or like maybe they're not presenting at the hospital, or maybe they are presenting at the hospital and they're just like untreated? Does that kind of make sense? Like how did
So
Texas Health determine those two?
I think this is a two-part question, and I'll let Julie answer the second part. But the first part, what I can tell you, yes, you're laughing. I'm giving you time though. The first part is that we do get admission data and diagnosis data from all the hospitals in DFW. And we can break them out by hospital and zip code and look at where the patients are coming to and how their diagnosis, right? So we can see how many patients that are self-paid, is what they're called, that don't have insurance from 75057 come into that HCA hospital that's there, and that their diagnosis is either more severe than it would have been had they received prior treatment. So in other words, they have a stroke instead of treating high blood pressure, or they come in for things that could be seen in a clinic because there's not a convenient clinic around. So they come in for sore throat. They come in to be treated for a sinus infection, and they're getting ED treatment instead of primary treatment. And that costs the hospital and the community thousands of dollars. I mean, thousands. And, and if we had a hard stop somewhere in the community that was open conveniently, because it may be after 5, where are you going to go after 5, right? If the clinic closes. And so access to that healthcare. And so we do have that kind of admission and diagnosis data by zip code. And we are able to look at what is the most significant diagnosis that's seen by zip code, and looking at their self-pay status. Julie, do you have anything to add to that?
Well, I would just add, we also pulled Census Department data and Bureau of Labor Statistics data to look at household income and demographics, all of that information, just to see where the need was. Also looking at the percentage of the population in that zip code that is uninsured, and the percentage of households that are receiving or are eligible for SNAP, which is food stamps.
Yeah.
And that kind of thing. So we looked at a variety of different sources, and really in some cases had to dig. We know, because we were looking at Healthy North Texas, the DFW Hospital Council Foundation data, and they have a socio needs index. It's actually called a health equity index now. They changed the name of it. And for example, Sanger actually scores really well on that, but we also looked a little bit deeper at census tract level data to identify those pockets. Even though Sanger appears to be well off as a whole, when you actually look at the census tracts within that zip code, you can see that there are significant pockets of need. And so that's what influences the leadership councils. I say our decision, really, it's up to the leadership council, who are not Texas Health employees. They are community leaders in our zip codes. And so they're the ones that take that data and make the decisions with it.
Does that answer your question, Colin?
Absolutely, and it informs us kind of where those holes are, those gaps. So I appreciate it. Thank you.
Sure. Anybody else? We still have 6 minutes, don't we? Yeah. We started at 10:30. So we have 6 more minutes to answer questions, but again, you know what Julie was saying and what we want to do is to make this a continuation by having resources online for you to put in your questions, have your questions answered. Plus you have direct access to, I believe, Julie's email. Yeah, Julie's email. And so you can ask questions anytime. One of the things that we have done and hopefully continue to do is make this grant process easy for people to succeed. We want to work with you. Even throughout the grant, you'll find that, we want you to succeed and we will, help you to succeed. This is not an adversarial relationship. And I've heard from one of our past grantees and may be continuing grantee that we've been real easy to work with. And so we want to start this process that way and end that process this way.
Okay, you ladies are going to get tired of hearing me, but we're such a huge organization that I got to ask questions for so many different divisions, and I have my team and everybody texting me, and I love this text that I just received. Okay, so we are really focused on cultural differences, speaking a language that's not spoken to fill the gap to help, different families in these areas that we're talking about. One of the things besides the health services that we provide, counseling, mental health, all of those things. And so I don't know if this counts, but let me go ahead and address this because I'm getting text this, is when it comes to certain type of economic issues that are being presented that do affect the mental health, everything, challenges that happen in the home, in particular to these group of people. One of the biggest things is we work with Martin Luther King County. And they do all of our services, but we ended up offering another division to them because of the issues that was happening in the home. And I'm going to give this as an example, is when it comes to things like even financial literacy courses that help them financially. And we know that this is a big issue that affects the other components we're talking about. Now, of course, those will be addressed, but since this is a collaboration, I'm thinking, okay, let me ask for this division. Is that considered part of this? As long as the other things are there, but if we're going to affect the whole thing, then we're affecting the whole thing. So that's my question. I see all of y'all doing your heads yes. I'm hoping the answer is yes, because that has got to be addressed. It's as equal as mental health issues as to why we're seeing that is that challenge right there. So if you guys could elaborate on that. I'm sorry, I don't mean to hog questions.
No, not at all. And, and we want that, food security, we chose is because, if you don't eat, there's a lot of other things you skip on. Right. And so obviously, we want that to be part of, what you address, but addressing, financial literacy is huge. And, being able to have a program that, at the end of the day, it's that it goes back to, give a man a fish he can eat for a day, but teach him to fish and he can eat for a lifetime.
We're talking about solutions. Yes.
Yeah. And so we want a solution. We don't want something that's just going to continue to keep somebody where they are. We want to see people move through and become, the independent person or family that they can. So definitely. And, and again, I don't want people to be overwhelmed. I want, to hear this is a collaboration. So remember, you don't have to do everything, right? You're going to collaborate with organizations that do a piece of that. So if you don't do food security, there's plenty of people in Denton that do food security, and you can partner with them to, develop that portion, of the grant. So, I mean, think big, outside the box. Definitely we see, what everybody does is a vital part of the health of the community. So, give us some innovative ideas.
Thank you.
And you're asking good questions, so don't feel bad about asking questions.
I appreciate it. Thank you.
Tracy,
Hi,
I just
this
have
is
to add. Oh, sorry, Letitia, go ahead.
I just wanted to ask to piggyback off what Tracy was saying. Hi, Tracy.
Hey, Letitia.
I just wanted to ask, like if we are doing financial literacy with adults 55 and older, and does that include their caretakers as well? Like if we say families, youth, children, all the things involved, and the people who are taking care of them?
Yes, ma'am.
Got it.
And I am posting in the chat the website, the page on our website that has the list of our current grantees, the grants that will be finishing up this December. And you can also navigate to the first cycle of grants from that page as well. So you can see all of our past awardees. And then Tracy, I was just going to say, I am a family and consumer scientist. I'm an old home ec teacher. So you are speaking my language.
And that's really good to hear, because I do think we have to challenge ourselves, not just to meet what you guys are asking, but my goodness, there's so many things that are raised in 3D right now. Let's go beyond just the healthcare, because we know these things affect the thing we're really trying to attack. So I'm really excited about this, ladies, more than you know.
Well, good, we are too. All right, it's 11:30. If there are not any more burning questions, you know where to put your questions if you come up with one after this webinar. And this webinar will be posted online, so if you want to go back and listen to it, you're welcome to. And then Julie is, I see, putting her contact information in the chat. Definitely contact her with any questions. You can contact me as well. I don't just put her out there, but I know that she likes that part, so I'm giving her her part that makes her really like her job. So thank you guys for attending, and we will hopefully be seeing a proposal from you guys soon.
Thank you so much.
Ladies.
Thank you.
Have a
Thank
good
you.
one. Bye-bye.
Bye.
Bye. Have a great day.
Thanks, you too.
Y'all too.